Hello and welcome to Take Your Medicine. Firstly, I would like to wish everybody a happy new year. I would also like to thank you all for your support during the past few months since starting the channel 6 months ago. Thank you all for your words of encouragement and also messages of support. It really gives me the motivation to continue making these videos, and I hope that I do add value to your health. Today's show we will be looking at over-the-counter medication that can affect patients suffering with epilepsy. Firstly, we need to understand what is a seizure and what is epilepsy. A seizure is a sudden, uncontrolled electrical disturbance in the brain. It can cause changes in your behavior, movements, or feelings and levels of consciousness. Some seizures may go unnoticed, while some may be totally disabling. Epilepsy or seizure disorder is a chronic disorder that is usually diagnosed after a patient has 2 unprovoked seizures. So, to understand this better, when we think, in our brain, synapses carry out thoughts on messages via a network of synapses. Messages are passed from one synapse to another via an electrical charge. Now, when you have interference in the normal neural pattern, which may be caused by an abnormality in the brain circuitry or nerve signaling imbalance, or deviant neurotransmitter concentrations, or abnormalities of gated ion channels. Essentially, there is a problem in the pathway in the way the brain works, which leads to seizures. Thankfully, with anti-epileptic medication, many of these imbalances are controlled and many epileptic patients can lead a normal lifestyle. But sometimes, when you have a totally unrelated condition, for example, sinusitis, and use medication to treat it, the medication you use may cause an imbalance in the brain or interact with your current epilepsy medication. This can lead to treatment failure, which then leads to a seizure. So let's look at medication that can cause problems for epileptic patients. Firstly, we look at antihistamine medication. Antihistamines are used to treat allergies, allergic rhinitis, sinusitis, and is found in cold and flu medication, including some cough mixtures. Common antihistamine drugs used that may cause problems are Diphenhydramine, Promethazine, Mepyramine, Chlorpheniramine, Carbinoxamine. While some newer antihistamines claim to have a lesser effect in epileptics, it's best to seek the advice of your healthcare provider. The next drug we look at is codeine. Codeine is used in the treatment of pain and also dry cough. It's found in over-the-counter medication used to treat body pains and fever, headaches, and dry irritating coughs. While the exact understanding of how codeine causes a problem in the epileptic is unknown, it has shown to cause seizures. Next we look at bronchodilator medication. A bronchodilator is used to help reduce inflammation in the airways and relaxes the muscle lining the airways. This helps you breathe better. It's commonly found in cough medication, especially when treating a wet or chesty cough. The drug Theophylline in particular has been shown to be a risk factor in increasing the risk of seizures in epileptic patients and should be avoided. It can also interact with many epileptic drugs used to treat epileptic patients and may lead to treatment failure of these medications. Lastly, we look at caffeine. Caffeine is a known stimulant and is found in many over-the-counter medication, especially in combination drug products used to treat headaches and migraines. Caffeine can alter your drug's electrical signals and cause a seizure. Foods such as tea, coffee, sodas, and energy drinks may also contain caffeine and is not recommended for epileptics, so always check the labels of the food products that you buy to make sure of its caffeine content. Caffeine may also decrease the effect of anti-epileptic medication, so it's best not to use it if you are epileptic. So that's a list of the common over-the-counter drugs that I see sold and that should be avoided by epileptic patients. If you found today's show informative, then please hit the like button, as this ensures YouTube recommends this video to others who might find today's show interesting. Don't forget to subscribe and also turn on your notifications by clicking on the notification bell. Thank you guys for joining me. Take care. Goodbye.